Good afternoon, everyone. Great to have you still here. I had a great lunch today where we had technician, politician, and a clinician having a discussion of today's topic, digital healthcare. And I was challenging the team about what has been the most popular name of the day in the keynotes and the conversation. And I think everyone were agreeing that it was data. And we were also having a very heated debate about Finnish social and healthcare reform and who has the best Excel to justify the numbers and the savings. And I think this debate will continue for a while. Fujitsu is one of the largest global ICT companies. We're very passionate about technology, so I was the technician in the conversation. We're more than 150,000 employees worldwide. We operate in approximately 100 countries. And we spend about 1.5 billion euros annually for R&D. So we are really passionate about technology. What makes us different as a company is that we have a very unique vision. Our vision is that we're creating, with the help of technology, human-centric, intelligent society. And I think this really is something what we're also discussing today. How do we do the digital healthcare, putting the people in the center, doing it in a human-centric way? What I mean by human-centric, I'll give you a few examples. We're very dedicated for sustainable development, and we're committed to 17 United Nations Sustainable Development Goals. We're committed to zero hunger. How we do it? We are actually co-creating with a local greenhouse farmer to create a sustainable closed system greenhouse process, which means super efficient agriculture business. Our role there is to collect data, extract data from that process so that we can simulate and create the same kind of a process in a country where you would not be able to grow local food. And we do it here in Finland, and we take it worldwide with our cloud services. We're committed in sustainable cities. We do advanced image recognition, and we use AI to create traffic control, and we optimize traffic processes to avoid congestion in large cities. So we collect data, we use advanced analytic techniques to analyze the data to create a better city for the citizens. And we're also extremely passionate about healthcare. We operate in Finland in more than 40 different customers within the healthcare industry, both in public and private. We have been working in that industry for decades in Finland, and we are part of original developers of the Kanta service, and we have also done extensive collaboration with mission-critical national healthcare platforms such as Apotti, which we're creating at the moment. So we're very passionate about healthcare. What makes us unique as a partner for this room, for all you Finnish and Nordic colleagues, is that we want to now more and more bring the experience we have worldwide to this forum. So we want to take the AI capabilities, the IoT capabilities, the different kinds of semantic and advanced analytic capabilities to all of you. And we want to co-create with you to tackle some of the challenges that we have in Finland and in the Nordic countries. So I think we're sharing the very common view of the challenge we have in Finland. We have very polarized healthcare environment. We have, I think I heard the exact figure of 10% of Finns using up to 80% of the public healthcare services. But with the new technology, I think we can start changing the this trajectory. And I think the key here is, for example, how to identify and how to personalize the prevention. How can we target the prevention to the people who are actually in the need of that? And the key here is data and how we collect the data and how we analyze the data. Because I think if I ask the question, who wouldn't want to live for 100 years? I think we all want to live a long and prosperous life. But we want to live it in a way where we can live it with a high quality and good health. So what do we need to do in order to collect data and start using the resources we have, both in private and public healthcare, to ensure that we are targeting these resources in the right way? Because what we want to do and want to enable is that we have a long and prosperous life, living in our homes and living it in a healthy way. In Japan, we are already seeing the problems of the aging population. And this is the reason why we have been putting a lot of investment and a lot of research in supporting the elderly care and supporting the living conditions for the old people in their own homes. So what we have developed is a platform that enables you to collect multiple sources of data. And we enrich the data with sensors that we can apply to the homes. It's a combination of multiple sensors, vital sign sensors, motion sensors, acoustic sensors, different kinds of sensors that can start create a normal for your today's condition. Meaning we all walk in our own unique way. So how can you start creating a standardized pattern for anomaly if someone is moving in a different way, other than you have to teach the platform what is a norm for someone individually? So we have developed a platform that is able to do this. And through the normalization, it can start identify anomalies. Meaning, if your steps start to shorten, if you start to move less in your home, we can start creating different kinds of actions from these incidents, and we can start creating the clinicians to start target prevention and start to change this pattern if you're starting to go for dismobilizing yourself, or if you're starting to have some sort of, for example, dementia or other disease. We have done this in Ireland, we have done this in Europe, so there's some good experience of how to use this data and how to combine this to multiple sources of data. It's called a Kiruku program, and we're now bringing this to Finland as a pilot in a very near future. We also apply other advanced analytic mechanisms. What we have done in Spain with San Carlos Hospital is that we are applying advanced analytics in mental health care, meaning that we combine multiple sources of data to start supporting the clinicians to provide more accurate diagnosis for mental diseases. And this is exactly to create more preventive targeting of resources. Meaning if you have from different kinds of algorithms, we can find that you are more leaning towards alcoholism or drug abuse, we can start to prevent some of these to take place. And this is, of course, a result of being able to have the data available, being able to provide and use some of the analytics platforms with the help of data analysts, working with the clinicians, because our view for technology and digital healthcare is not to replace people. It is to empower people. It is to empower the patients to be able to select and use technology to improve their quality of life, ensuring that they can stay in their homes and live in their homes in a secure way and to prevent from being hospitalized. And it is also about empowering the clinicians making them better decision makers, making them more efficient decision makers in their work. So this is what we think is the human-centric approach for the healthcare. So how we do it? We want to work together with all of you. We believe in the power of co-creation. We want to be in different kinds of ecosystems to innovate and to co-create. We work in the Clever Health Network, facilitated by HUS, and we have already in Finland submitted our first initiatives for gestational diabetes investigation with the partners. So we want to be an active player in digital healthcare here in Finland, and we want to be open for different kinds of forums for cooperation. We promise that we bring the global expertise, we bring the technologies, we can be the technologists in the conversation, but we want you to be the partners for coming up with the solutions for the challenges that we're facing in Finland and in the Finnish healthcare. So with that, I hope I gave you a little bit of flavor for what Fujitsu is and does in healthcare, which is definitely something else than just hardware or laptops. But we're very serious about digital healthcare, and we're putting a lot of investment and effort to become the partner for solving some of these challenges that Finland is seeing, and we're together facing in our day-to-day life. So thank you very much for your attention, and have a great afternoon. Thank you.